Hello, my name is Dr. Miriam Krause, and today I would like to talk about pelvic pain. Pelvic pain describes any pain that occurs in the pelvic region, usually below the belly button, that is present for at least 6 months. That pain can be cyclic or continuous. It can be related to the menstrual cycles, or it can be unrelated to menstrual cycles. And as you can imagine, there are a lot of different organs in the pelvis, the female pelvic organs, but also other organs like the bladder, bowel, and any of these organs can contribute to pelvic pain. So in order to find the correct cause of the pain and then know what the best treatment is, oftentimes we need a multidisciplinary team that may consist of a gynecologist, a urologist, a gastroenterologist, and possibly also a chronic pain specialist. There are two big categories to group pelvic pain into. One would be gynecological causes, and the other one would be extra-gynecological causes or non-gynecological causes. So non-gynecological causes would be, for example, anything related to the bladder, such as a chronic urinary tract infection, bladder stones, or bladder diverticulum. Gastrointestinal problems could include chronic appendicitis, diverticulosis, Crohn's disease, or irritable bowel syndrome, just to mention a few. Also, pelvic muscle problems, such as vaginismus or pelvic muscle spasms, can cause chronic pelvic pain. The gynecological causes would include anything of the female organs, such as the ovaries, fallopian tubes, and the uterus. There can be cysts on the ovaries, they can lead to ovarian torsion, there can be fibroids or polyps in the uterus or on the uterus, and there can also be endometriosis. As I mentioned, finding the correct cause for the pain will make it easier to treat it effectively. The one thing I want to briefly focus on is endometriosis, because that's what I see the most frequently in my office in patients who have pelvic pain. Endometriosis is a condition where the cells that usually only grow on the inside lining of the uterus will start growing outside of the uterus, usually in the pelvic region. And these cells can cause problems. They can cause pain, lift periods, heavy periods. They can cause problems with fertility. We don't understand why some women develop endometriosis and others don't, but if you are found to have endometriosis, we have different treatment options available, and it mainly depends on whether you want to get pregnant or whether the main goal is to help with the pain. Treatment options would be birth control, pills, patches, different forms of hormonal suppression, sometimes leuprolide injections. Sometimes surgery can be helpful where the endometriosis is actually removed. And if you desire pregnancy, then other options would include making your ovulation stronger, the pills like clomiphene or letrozole, adding an intrauterine insemination, or potentially in vitro fertilization. So if you have questions about pelvic pain or endometriosis, then please contact us. Thank you.